Okay, next we have Jungmi Park, who is a PhD student at the Graduate School of Public Health at Seoul National University with research focused on physical activity epidemiology. She has presented research on the association between physical activity and depression through isotemporal substitution analysis and is currently exploring the physical activity paradox, which investigates different health outcomes across physical activity domains. Additionally, as a member of the Tobacco Endgame research team, she has conducted an online survey to measure public support for tobacco endgame policies in South Korea and is presenting these findings here today. Thanks very much.
For the kind introduction, and I'm privileged to present our study today. So today I would like to introduce the public support for tobacco endgame policies in South Korea based on the online survey result. And before we begin, I would like to disclose that this study was supported by the Korea Health Promotion Institute, and we declare there are no competing interests. Although the smoking prevalence in South Korea has significantly declined since 1998, but recent data show a stagnation, and it underscoring the need for stringent tobacco control measures. The current adult smoking prevalence is near 15%, indicating a critical point for implementing tobacco endgame policies. The success of these policies hinges on robust public support, which is essential for their sustainable execution. So the purpose of this study is to explore the public awareness and support for establishing a tobacco endgame board and endgame policies through public support survey. We conducted an online survey. We conducted an online survey in November 2023 involving 1,544 Korean adults aged 20 to 69. Sorry, just check your phone. The survey gathered data on demographic characteristics, tobacco use history, and support for 15 proposed tobacco endgame policies. Survey weights were calculated based on region, gender, age, and smoking status to ensure the representativeness of the population. So this is the general characteristics of our participants. So we asked about support for strengthening existing tobacco regulation policies. Our result revealed high approval rate over 80% for policies like designating or indoor facilities, non-smoking areas, implementing plain packaging, and banning all forms of tobacco advertising. However, the proposal to increase tobacco prices garnered relatively lower support at 66.7%. Next, we examine support for the tobacco endgame goal. 80.8% supported the idea that the government should establish policy objective to reduce the adult smoking prevalence to below 5% within a specified period. Regarding the target time frame, 1.7% responded that it should be within 10 years, while a similar proportion opted for 5 years. Regarding the tobacco products that should be included in the tobacco endgame goal, 44.1% believe that cigarettes, heated tobacco products, and e-cigarettes should all be included. Following this, 32.7% believe that the focus should be on cigarettes only. We also assessed public backing for 15 specific endgame policies that can be grouped into 4 main categories: product-focused, user-focused, market supply-focused, and institutional structure-focused. And most of the proposed endgame policies received majority support. And now I will examine in more detail the 3 policies that show the highest levels of support among these policies. Ban the sale of tobacco within 500 meters of elementary, middle, and high schools policies gained the highest support for the public and prohibit the sale of tobacco in retail stores and allow it only in specialized tobacco shops that are inaccessible to the minor, and ban all additives, including flavorings, in cigarettes and tobacco. And these policies gained support from over 17% of current smokers and even higher approval between 80 to 90% from former and non-smokers, showing strong support across all groups. The high levels of support for these policies can be interpreted as reflecting a strong public commitment to protect youth and reduce the attractiveness of smoking. These measures target both the accessibility and appeal of tobacco products, which is crucial factors in preventing the initiation of smoking among young people. By limiting where tobacco can be sold and removing enticing flavors, these policies could significantly lower the rates of tobacco initiation and usage among minors. But furthermore, we observed the greatest differences in support levels among smoking status groups for the following policies: increase the tax on tobacco products by 20% a year until less than 5% of people smoke. Set a quota for tobacco products manufactured or import and reduce it on a yearly basis, thinking read policy, and reduce the number of places where tobacco products can be sold to less than 5%. While current smokers showed support levels of 40 to 50%, non-smokers showed much higher support levels of 70 to 80%, indicating a significant difference of over 30%. These policies directly affect current smokers by increasing the financial burden of purchasing tobacco and limiting the availability of tobacco products. Such direct economic impacts and reduced accessibility understandably lead to a higher level of opposition from current smokers who are most affected by these changes. So in conclusion, we found the public has shown high levels of support for establishing a tobacco endgame goal. Most of the proposed endgame policies received majority support. Notably, there was strong support for banning tobacco sales near schools, restricting sales to specialized shops, and banning all additives to tobacco products. Support levels vary by smoking status group for certain policies, and policies with high support across all smoking groups could be prioritized for implementation. These include the policies mentioned above, which have garnered widespread backing from various segments of the population. And over the findings underscore the public's readiness to back stringent tobacco endgame policies to end the tobacco epidemic. This strong public support provides a solid foundation for policymakers to advance broad measures aimed at significantly reducing tobacco use and its associated harms. So this concludes my presentation, and thank you for listening.
Thank you, Jungmi, for your interesting presentation. So I'm aware that there's a similar study done by using the ITC core data. So how does your current study add value to that study?
Thank you for the question. The prior study about the public support in South Korea is based on the 2020 ITC survey, and our study used more recent data, and also we tried to survey more specific and various policies. ITC survey questions, or for example, it asked about the restrict the number of places where cigarettes could be sold, but our survey uses more various questions like reduce the number of prices to less than 5% or sells only in the specialized shops or pharmacies like that, so we can explore more specific scenarios. Thank you.
Any other questions from the floor? I noticed that you had in there, there was actually quite high level of public support for pharmacy sales of tobacco as an intervention. What's the current situation for tobacco sales in pharmacies in South Korea? Do pharmacies sell tobacco products?
Pharmacy do not sell the tobacco products, only in the retail shops sells the tobacco products.
And so in the question when asked about pharmacy only sales, I think I read that correctly. Did you ask about was it put to people that they'd have to have a conversation with a health provider like a pharmacist before they could purchase, or was it just like a normal, it didn't specify, it could be just a normal over-the-counter product?
The policy about the sales in pharmacies is related to the cessation age. So maybe pharmacy can be profited by the cessation age, not the tobacco products. Yep.
It was framed in the context of accessing smoking cessation support. That's great. And I also noticed that there was quite a high level of support for specialised shops with an age restriction. So currently, I assume, do you have specialist tobacconists currently in South Korea? Or
In South Korea, there is a specialized shop only in the e-cigarettes, and the conventional tobacco products are sold in the retail shops.
So this would be quite a new policy too then, that they're not used to seeing tobacco-only shops. And also, I assume those, are the e-cigarette shops age restricted, or are they just open to anyone?
E-cigarette shops is only for the over 80 years old, for only adults.
So this would be like applying what's in place for, e-cigarette shops have to be 18 plus, and then that would be applying that to tobacco then? Is that correct? As the scenario that people were supporting or not supporting? Sorry, that wasn't I think that was a bit complicated how I worded that. So it sounds like the e-cigarette shops are age restricted when people go in to buy them. So this would be applying the same sort of restriction on tobacco sales and in specialised tobacco shops for that policy?
I know that Jungmi has her answers in Korean. It just doesn't come up at the top of her head in English. So in the South Korean context, all cigarettes, e-cigarettes, and heated tobacco products are regulated by the same law, and they're classified as tobacco products. So the same age limitations, a little different tax rates apply, but they're generally regulated the same. So what we're thinking here is that, and because the public also thought that our endgame goal should encompass not only cigarettes, but also e-cigarettes and heated products, even for the retailing environments, we would probably apply the same rules for all three products in Korea.
Excellent, thanks. Okay, if you have no further questions, then we'd like to thank Jungmi. Thank you.